Ever wondered why some leukemias respond to treatment, while others relapse aggressively within months? Or why anemia in cancer patients isn't always due to blood loss? Let's unpack that. From clonal hematopoiesis to the molecular pathways driving malignancies, the MD Anderson Hematology and Oncology Board Review 2023 breaks it all down. Here's a powerful summary you'll wish you had before your last exam. First, let's talk acute leukemias. This course dives into the cytogenetic and molecular markers that define prognosis and treatment, like FLT3, NPM1, and IDH1 mutations. It clarifies why not all AMLs are created equal, and how this affects chemo versus targeted therapy decisions. Moving on, lymphomas. You'll finally understand the difference between indolent and aggressive subtypes based on cell origin, behavior, and why R-CHOP isn't always the go-to. Plus, the board pearls on diagnosing Hodgkin lymphoma using Reed-Sternberg markers. Pure gold. Then comes solid integration, anemia, coagulopathies, and paraneoplastic syndromes, explained not just for memorization, but with clinical reasoning. You'll see how labs, marrow biopsies, and peripheral smears work together like a diagnostic puzzle. And if you're prepping for boards, you'll love the rapid-fire Q&A sections at the end of each module, high-yield, focused, and exam-accurate. This isn't just passive review. It trains your brain to think like a clinician. If you're in med school, residency, or prepping for hematology-oncology boards, don't sleep on this one. For the complete PDF and full access to the original content, check the link in the description. Don't forget to subscribe for more medical breakdowns like this. Hit that like button if this helped, and share it with your study group. Mastering Heme-Onc starts right here.